Tell me a bit about your career just as a change agent and project management professional, doing some of those transformative projects, onboarding, doing the EMR adoptions. Like, what have been some of the coolest things you've worked on with clients?
Yeah, so I've been very fortunate to have been, probably just in the right place at the right time. A lot of the career to just get the opportunity to work on many of these things. The short version is I've been in the consulting space most of my career, which leads to those kinds of opportunities. So just by virtue of the way that world works, is you're brought in for special projects, projects that are at risk, or a client is looking for a certain skill set or expertise for something that can be transformative. Early in my career, I worked for a company that had a very good reputation in getting involved in a lot of those things. So early on, one of the neatest things was just helping develop the or documenting the strategy for Alberta right before AHS formed. So we were going out and talking to Capital Health Region and Calgary Health Region and RSHIP, like the remote or the rural and remote groups, and then AHS formed, and you kind of get a sense previous to what happened there. And then I also worked for POSP, the Physician Office Assistant Program, on contract, as well as PEDO, when doctors were transitioning from paper to electronic. So I got to see that shift, which was I
How
learned a
did that
lot
go?
for sure. Yeah, different. Right time in the career where you're actually seeing how, a very well thought out, would say in many cases, process from paper to actually having to go through that change to something that was totally foreign. And then even being part of implementations later on that went from like electronic system to electronic system, being able to compare those two was pretty neat. So I did, probably 75 plus clinics of various sizes.